from Missouri.
Oh, she went to school in Texas.
Yeah, I think she's going to Missouri. I don't know, I didn't ask. I barely saw her because she didn't come up last week. Except for like one day and we didn't overlap.
You sound bitter.
No, I'm going on vacation in a week and a half.
Imagine that. What globetrotter are you going out?
To see my girlfriend and then go to home to see my dad for 2 days.
Bring it all back to us.
I'm going to San Francisco. I'm going to San Francisco and then flying to LA to see my dad is coming back. My first flight got canceled. There were only 6 people on it. The next one only has like 20.
Well, vacation in June, man.
Flew from Dallas one time, the other six from Dallas. Well, there were 4 of us on
Wednesday,
there.
well, that's Thursday. Thursday to yesterday. I was supposed to, usually we have a
They
bunch
just
of people
opened
at our
their
house.
house.
Okay. All the bowling got her
It was a
stuff.
Sunday night. I can't
We didn't do
remember.
anything.
I think it was from there to here.
I've been on that flight going the other way en route to El Paso. You ever done Northfield to El Paso? You basically land the same time you took off with the time
No,
because it's only like an hour flight.
exactly.
You gain the hour.
Because it's like 23 minutes to get to Abilene from DFW on Eagle, American Eagle.
Are they still running that flight?
Oh, yeah.
Oh, jeez.
And they have 9 flights a day. It's a maintenance hub.
Oh, okay.
And almost every one is full.
Jeez. I went to school American Eagle from DFW to Laredo.
Yeah.
They run a bunch of those too, because it's all the truckers that like pick up their loads and drive north and come back.
Yeah.
I was stunned how full that plane was. And they run like hours.
Ours is full with wind farms. Yeah, there's a lot of wind farms.
That makes sense.
No, I gotta say, no. Jeez.
Pressure's on.
I'm glad you guys are here. I thought I was gonna have to ask like 10 questions, you know?
I can wait. Depending on how late this goes, I may have to. I'll have a 3:30 hit.
Oh, God. That's gonna get awkward. No. And
No,
it's
these
just
are
2.
usually
It's not
not
like
that
the
long.
whole.
Yeah, no, it's not the whole
Hopefully,
demographic.
I didn't see Delora. I didn't see, like, hopefully it's just.
She says any questions, you just guys are like, nuts.
No, I'm
Hey,
good.
Got
I've been at
nothing.
press conferences like that before, and you're like, oh, man, so bad.
Yeah.
I couldn't stay away.
I was wondering where you were.
You're too lonely in that Senate booth.
I'm not even in the booth, man.
No?
No.
Russell?
Yeah.
Who's your camera?
Hmm?
Who's your operator?
Usually it's Jocko, but
Oh, that's right.
he's out sick today.
Uh-oh. You okay?
He says it's a stomach thing, so.
Okay.
Well, that's a relief.
I mean, like, you're like, oh, thank goodness.
Heads up, folks.
Thank you.
Is space sufficiently? Good afternoon, everyone. Here we are. When we invited you to this meeting, we were going to be talking about three things: testing, testing, testing. Testing to open up our economy. Testing to send our kids back to school. Testing to defeat this villainous virus, the coronavirus. Little did we know that we would be coming here almost at the exact time when our country would be registering 100,000 people dying from the coronavirus. 100,000 people in about 100 days. Think back 100 days. Think, we just observed Memorial Day. Think back to President's Weekend. Would you have ever thought that we'd be observing 100,000 people? So I'm honored to be here with our distinguished whip, Mr. Clyburn, Frank Pallone, the distinguished chair of the Energy and Commerce Committee. They're going to share their views about saving lives by testing. There have been outstanding forces in the Congress on this subject. We're also delighted to be joined by Representative Robin Kelly of Illinois, who was the chair of the Congressional Black Caucus Health Brain Trust. Grace Meng of New York, a leader in this House of Representatives, a member of the Appropriations Committee. Mr. Pete Aguilar, another member of the Appropriations Committee. And Deb Haaland, a new member of Congress, chair of her subcommittee on natural resources. All of them leaders in the Congress, and with something to say from their standpoint generationally, geographically, ethnically, and committee-wise, and the rest. So in our first bill, March 4th, we wrote it in February, passed it in March 4th, testing, testing, testing. That was what the bill was about. We thought that the executive branch would act upon that. They did not, but we put out that commitment. By the time the president signed CARES 1, which was March 28th, we had March 4th, March 14th, and then March 28th, our third bill. We had some funding for hospitals and healthcare and the rest there, PPE, addressing the spread of the coronavirus. And then when we did the PPP interim bill a couple of weeks later, that was the place where we put a big chunk of money for testing and for hospitals and the rest. Still, we had not seen what we would have expected from the administration. So over the weekend, they put out something. I won't call it a plan because it wasn't a plan. A plan has a strategy, it has a goal, it has a timetable, it has benchmarks, it has milestones. It didn't have any of the above. No guidance, real guidance for how we can test, trace, treat, isolate, defeat this virus. In our bill that we put forth in the HEROES Act, we provide just such a strategic plan of action. And I'm so pleased that our distinguished chair of the committee, Mr. Pallone, is here to talk about it. For a long time, Mr. Clyburn has been talking about how we do outreach into underserved communities. He used examples of previous health issues in rural America where they had mobile units going out to reach out to people, to provide services to them to save lives and limbs, as it turns out, lives and limbs. In the bill that we passed, the HEROES Act, it strengthens the testing and contact tracing by requiring updated testing plan with clear benchmarks and timelines, as I mentioned. It provides $75 billion in grants to support testing, tracing, and isolation, with a special focus on addressing disparities on how this villainous virus is assaulting communities of color in our country, and requiring culturally and linguistically appropriate strategies for increasing access to testing and tracing. It's one of three pillars. Our first pillar is honor our heroes, state and local. Open our economy, testing, 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 money in the pockets of the American people. Three pillars of our HEROES Act legislation. This is the testing pillar. It is essential. for the economic recovery of our country. It is essential for the health and well-being of the American people. It is essential to sending our children back to school. It's usually always about the children. So we expect that we will go to the table to do the smart thing that scientists all advise we must do if we're going to win this battle against the virus. We must test. It's central. We must trace. It's central. We must treat. It's essential. The Republican leader in the Senate says, we think we need a pause. I don't think the virus is taking a pause. I don't think hunger's taking a pause. I don't think job insecurity is taking a pause. I don't think paying your rent takes a pause. We don't need a pause. We need action. And today we're focusing our action on testing, testing, texting. And with that, I'm pleased to yield to the distinguished Democratic whip of the House, the gentleman from South Carolina, Mr. Clyburn. Now, how are we doing this? I go over here.
This is very
You go over
precious.
there. I'm not passing it by.
Thank you very much, Madam Speaker. Today, we are witnessing the 100,000 people who have perished in this country because of this virus. This virus has visited every family, including my own. Our colleague, Maxine Waters' sister, we lost her to this virus 2 weeks ago. On March 19th, as we held a caucus via the telephone, I said to my colleagues that this challenge offers us a tremendous opportunity to restructure things in our vision. I was vilified for that by some of my friends on the other side of the aisle, but the fact of the matter is, our vision is embodied in the pledge that many of us grew up every morning reciting. Our pledge of allegiance to the flag closes with the vision of this country, with liberty and justice for all. I don't back away from that. My reason for existence is to help this country live out that pledge that many of us know has gone unfulfilled for many, many years. Just this morning, the Washington Post has published a pretty significant interview that it had with Senator Marco Rubio, the Republican senator, who chairs the Small Business Committee of the Senate. He talks in that interview about his own parents who came here. One, a maid, and one, a bartender. And he says that if this pandemic was here 35 years ago, he talked about what it would have done to his family, because both of them would have lost their jobs working in the service industry. And he talks in an interview about how the structure that we operate under in this country subjects those who work in service industries, those who cannot work from home, how this virus is devastating their communities. And he used the term in his interview today, the structure that we have, irrespective, if you set all the other differences aside, discrimination, you set aside race, ethnicity, the structure is of such that it renders these families incapable of coping. The select committee that the Speaker has appointed me to chair held its first briefing 2 weeks ago. And in that briefing, we brought 2 commissioners, Republican commissioners, I might add, to talk about former CDC directors, to talk about what it would take to reopen safely. Both of them said it's testing. We got to test. We got to trace. We got to isolate. And we got to treat. That's what has to happen. And as the speaker just indicated, that non-plan that was published by this administration, that non-plan talks about delegating or relegating all of the testing to the states. That sets up a state-by-state approach which cannot offer the kind of coordination that we need for the country to recover. And so, as a speaker indicated, I have a personal relationship with testing. I worked with Senator Hollins years ago when he was in the Senate. We discovered that in South Carolina, we were leading the nation in amputations because of the late detection of diabetes. My wife, who transitioned last September, fought a 30-year battle with diabetes. So Senator Hollins and I worked together to send mobile units throughout rural South Carolina. And we dramatically reduced amputations. So when my wife passed away after her battle, she still had all of her limbs. But when her daddy passed away 30 years earlier, he was a double amputee. That's what testing will do. Early detection, and sets up the kind of tracing that we need so that we can isolate effectively and treat efficiently. The administration needs to maintain its responsibility to coordinate nationwide what we need to overcome this pandemic. And with that, I'll yield to my longtime friend, the gentleman from New Jersey, Mr. Pelosi.
Let me, first of all, let me thank our speaker for putting this press conference together today and all the things that she's done to stress testing. Every time we talk to her on a conference call, it's testing, testing, testing. And then let me also say about Jim Clyburn, what he just said in terms of the significance of testing and how to achieve it is right on point. We're not going to be able to reopen this economy unless we have an effective national testing strategy. That is the key, and that's the key to eliminating the virus, because as we reopen, there may be new hot spots that occur that have to be closed again, and we're not going to be able to achieve an end, if you will, to the pandemic without effective testing. Now, the president has failed us. I can't stress it enough. This is a national emergency. He acts like it's going to be state by state. I drove down here yesterday, right? When I come from New Jersey, I can go through New Jersey, Pennsylvania, Delaware, and Maryland in about half an hour, right? How does it make any sense when you have a national emergency to have each state doing its own thing? The only thing that I can see from this report that we've been critical of over the weekend is that essentially this administration is providing technical assistance to the states. That's essentially what it is. You come up, New Jersey, you come up, California, with your plan, we'll look at it, and then we'll let you implement it, and we'll give you some help. We'll give you some supplies. We'll send the CDC if you want some assistance. But that's not going to work. When I talk to the administration people, they don't see it as a national plan. They say, okay, New Jersey's trying to achieve 7 or 8% of its population being tested. Another state, Texas, might be at 2%. And that's fine with them, because they're not even setting a national goal as to what kind of how many people you should test in your state. In addition to that, the supply chain, we're relying on that same broken supply chain that has existed for medical supplies. They need to appoint a national czar who passes out and basically coordinates the supplies, because otherwise, just as we did with medical supplies, we're going to see the same thing with this testing capacity. We're trying to build the testing capacity across the country, but the states are going to have to buy things through private enterprise, compete with each other to get the actual test kits and the supplies to actually do the testing. So this is the problem. What we're saying is in the HEROES Act is essentially we want to change that. And this is why the HEROES Act has to pass, because when the president gets up and says, well, everyone can be tested and we're going to have millions of tests, that's not a promise that he has the ability to fulfill if he doesn't have a better national strategy. So I just wanted to give you an example. In the HEROES Act, and I don't like to read legislation, but I'm going to read it in this case. It says, the plan shall identify the types and levels of testing necessary to monitor and contribute to the control and reduction of the virus, okay? It says the plan must include specific benchmarks with clear timetables regarding how to ensure sufficient availability and allocation of testing materials. And it talks about that for vulnerable communities. And then it talks about the fact that we have to do testing in a non-health situation. So let me give you an example, like an employer, right? An employer decides that they want to reopen, right? There isn't anything that the federal government or the Trump administration is providing about how you go about reopening, how many people you have to test before they can go back to work. If you do tracing, how many people have to trace back and be isolated? Nothing like that. That just doesn't exist. You could even use it for houses of worship, right? The president said over the weekend, well, everybody should be able to go back to church or synagogue, right? Well, how is that determined? And how is that linked to the testing of the people that would go to the church or synagogue? Does that mean that 10% of those people that go to that mass or to that service this Sunday will have been tested? No, there's nothing like that. That's, again, left up to the states to decide. So what we're saying is if we don't have clear benchmarks, how many people have to be tested? If it's not uniform across the country, if we don't have uniform tracing and clear timetables for exactly how that's going to be done, we're never going to eliminate this virus or significantly cut back on the virus. And finally, the most important thing is transparency. So what the HEROES Act says is if you've got to be transparent. We want reports on exactly how many people are going to be tested. We want reports on how many people are going to have contact tracing. We want to know how successful you've been in meeting these national goals. That's all we're asking. It's not a difficult concept, in all honesty, but if the president continues down this path of just leaving it up to the states and, you're on your own, we'll give you a little help here and there, then we are never going to be able to reopen effectively and put an end to this virus. And the most important thing is pass that HEROES Act. Senator McConnell take it up, and if the president's not willing to do this now, then we will mandate it by law. And next, I'd like to introduce Robin Kelly, who's a member of our Energy and Commerce Committee and the chair of the CBC Brain Trust.
Thank you, Chairman Pallone, and thank you, Speaker and Whip, for all of your leadership. The president doesn't want to have a national strategy because then he'll get blamed if something doesn't go right. So it's easy to say the states need to do it, so then the states take the blame because he's not responsible for anything. But as chair of the Congressional Black Caucus Health Brain Trust, I can tell you that we certainly need more testing in communities of color, the very communities that are home to our frontline and essential workers. The HEROES Act will bring testing and critically important contact tracing and mobile testing to more American neighborhoods. We can't always expect families to travel long distances during a pandemic, and not everyone has a car. My district is urban, suburban, and rural. Maybe in the city people can get around, but I can tell you in the suburban part of my district, and especially the rural part, if you don't have a car, you're in trouble. We need to put more testing resources in our communities so those most at risk can get tested. Unfortunately, once again, the Trump administration has no plan. I think it's by design. This time, the lack of a plan means that Americans are dying from COVID-19. Communities aren't being effectively tested, and we aren't bending the curve as much as we could. Whip Clyburn talked about a lot of us have been affected. I lost my uncle 10 days ago. The chairman talked about churches. He went to 60 people, 16 people were affected by the virus. Frankly, the failure of the Trump administration to have a testing strategy means that more Americans will die from this virus. It's time for Mitch McConnell to stop confirming unqualified judges to the federal bench and hold the vote on the HEROES Act, because testing saves lives. But the HEROES Act does much more, and I want to highlight a few other elements. Matching fund waivers for our first responders so they can get the PPE they need to keep themselves and communities safe. Grants to medical schools in diverse and underserved areas, including HBCUs. We not only want to be the victims, we want to be a part of the solution. Grants for technology to build capacity and learning for health workers and centers serving communities of color. Additional CDC reporting, even though the last report was garbage, and a field study on COVID-19 racial disparities, because less than 3 pages with links is just not good enough. A modernization of health data collection, especially health inequity data, and culturally appropriate COVID-19 awareness campaign. Let me be clear, these provisions, coupled with the testing that the speaker always talks about on the HEROES Act, will save lives and help us get through this crisis. Again, I want to thank Speaker Pelosi and Whip Clyburn again for their leadership on this important issue. And I'd like to introduce my colleague and classmate, Congresswoman Grace Meng of New York.
Thank you, Speaker Pelosi, Whip Clyburn, Chairman Pallone, for organizing today's press conference on the Trump administration's lack of national testing strategy. While President Trump took time this weekend to play golf, my constituents in New York were looking for testing, delivering PPE, and burying their loved ones. 100,000 Americans have died in our country because of COVID-19 since early February. And President Trump has clearly failed to lead us through this national health crisis. And we have gathered here since late February in bipartisan briefings, asking for strategy, asking for help. He has continued to downplay the threat of the virus, try to absolve himself of all responsibility, and has wasted so much valuable time and lives as people needlessly die. And now he wants to reopen the economy, despite his failures. And of course, we do need and want to reopen the economy, but we can't do it safely without a rigorous and bold plan in place. I've been in Queens, in my district, since this crisis unfolded, and I can tell you that this must be in place for our economy, not just in New York, but across the country, and our way of life to return to normal. New York and Queens County has been the epicenter of this public health emergency. 1/5 of the 100,000 people who died are from my home state of New York. My district has seen it all, from surges of patients flooding our hospitals, hospitals on the brink with limited staff, PPE, our elderly population succumbing to COVID-19 in nursing homes, small businesses in financial distress, families at risk of homelessness, and essential workers risking their lives to keep our cities running. We did not have sufficient testing capabilities at the beginning of this pandemic, and we still don't have a robust plan now. I will tell you, as a parent of 2 school-age kids, our schools have a more robust and centralized system for testing and tracing head lice than this president does for the coronavirus. And it means that we can't test everyone who may have COVID-19 symptoms or healthcare workers who work in high exposure areas because of this lack of strategy. My constituents might be asymptomatic. They might not know that they have the virus, and yet they continue to go to work. They might have to return home to overcrowded living situations, and they might be in nursing homes, potentially contaminating people around them. So consequently, it makes our fight against this highly contagious and invisible enemy even harder. As we're battling all these changes, COVID-19 has ravaged our communities of color. especially the Black and brown communities, and has only exacerbated already existing vulnerabilities, inequalities, disparities, especially in access to health care. Inadequate access to health care, including language barriers, financial obstacles, not having health insurance, increases these disparities amongst already vulnerable populations. Elmhurst Hospital, the hardest hit hospital in the country, is in my district. The area around the hospital is one of the most ethnically diverse locations in the country, where more than 125 different languages are spoken. Additionally, health disparities are often magnified for individuals who have limited English skills. For weeks after the public health emergency was declared, the federal government provided little or no information about COVID in any language other than English, leaving millions of people in the dark. And that is why passing the HEROES Act is a transformative step forward, as it would deliver a clear national testing strategy and $75 billion to ensure that we stop the spread of the virus by testing and tracing people. And I thank Speaker Pelosi for her tireless leadership. This bill would ensure public health departments use culturally competent and multilingual strategies to provide awareness of COVID-19, access to testing, and actually reach the people. The Senate must immediately pass the HEROES Act. The American people cannot wait another day. Thank you.
I want to thank the Speaker and the Whip and Chairman Pallone for putting this press conference together and for their steadfast advocacy in support of robust testing strategies. We're here today because our communities cannot afford any more inaction. Our communities cannot afford to wait while the Senate and Republicans ignore the crisis facing this country. And our communities know that we need national, robust testing that was included in the HEROES Act. Simply put, we need a plan. That's what the HEROES Act is so important. The bill lays out $75 billion to create a national strategy to increase testing and contact tracing, funding that is crucial in communities like mine in Southern California's Inland Empire. The lack of a national testing strategy by the Trump administration has led to a patchwork between healthcare providers, the counties, and the states, and our local communities. While our local governments are strapped more than ever, they're being forced to create a plan based on this pandemic. That's why the HEROES Act is desperately needed. Not only does the HEROES Act increase the testing capabilities, but the thoughtful strategy to help medically underserved communities like mine moving forward as we reopen our economy. We know that people of color are experiencing infections at a disproportionate rate, which has led to a higher rate of hospitalizations and infections and death in these communities. In a recent ABC News poll, 26% of Latino respondents said they know someone who's died of the coronavirus or complications from the coronavirus. And it's easy to understand why. In many parts of our country, Latinos overwhelmingly make up the service industry. This means that many members of my community are risking their health and safety every day as essential workers while our country struggles to reopen and while Senate Republicans do nothing. Latinos are more likely to live in multi-generational homes, increasing infection rates in the communities and within their families. That's why the HEROES Act includes grants for schools in underserved communities and requires reporting to Congress on the race and ethnicity of those receiving tests, hospitalizations, and other metrics that we know communities most in need can get the help that they need. Too often, communities like the Inland Empire are left behind, but the HEROES Act gives us a fighting chance. As the Vice Chairman of the Appropriations Committee, I was proud to play a role in getting this legislation through the House, and it's time that the Senate get back to work and do the same. And with that, I'd like to introduce my colleague, Deb Haaland from New Mexico.
Thank you all so much. Thank you, Speaker Pelosi, Whip Clyburn, and Chairman Pallone for your leadership in addressing the urgent need for a bold nationwide testing strategy. We all know that a healthy workforce provides for a healthy economy, but this administration has failed us. It has failed to ensure that at the least, all essential workers have the confidence to know that they will not contract this virus at their jobs. This administration has left states, cities, and tribes to fend for themselves, to fight for testing supplies, and has been unforgivably slow to ensure communities have what they need. Currently, Indian country is suffering a disproportionate number of cases because the agency charged with the health of Native Americans has been sorely underfunded for decades, in fact. And that's why House Democrats included $2.1 billion for the Indian Health Service in the HEROES Act. Currently, there are significant concerns by tribal leaders about testing machines across Indian country, giving an overwhelming number of false positives. The supplies to Indian country came way too late and have not caught up with the spread. For example, in Rapid City, South Dakota, the second most populous Native area, a tribally managed healthcare facility was only given 24 testing kits per week. The HEROES Act will provide $64 million for urban Indian health centers. On top of this administration's testing failures, the facts are that many Native communities don't have running water, electricity, or broadband internet service. This administration has not given Indian country what it needs to fight this pandemic or shown that it even cares. And at this point, I'd like to ask Leader McConnell, does he care about Indian country? House Democrats took action to make testing free, and now it's come to the time that we have to take direct action to ensure this administration meets the benchmarks to increase testing and contact tracing so we can reopen safely and responsibly, and I thank you all for caring about this issue. And I yield back to Speaker Pelosi.
Thank you very much, Congresswoman Holland, Madam Chair. As you can see, my friends, whether it's California, Pete Aguilar, Illinois, Robin Kelly, New Jersey, Mr. Chairman, Frank Pallone, New York City, Grace Meng, Deb Holland, New Mexico, Mr. Clyburn, Mr. Chairman, Mr. Whip, Mr. Clyburn, South Carolina. Is that all of us? And California as well. All over the country, we have the same message for the President. Mr. President, take responsibility. You heard that in every comment that was made. The refusal to take responsibility is taking lives, livelihood, and again, the vitality, the life of our democracy. This testing is the key. It is, you cannot cross the threshold inside to outside to open the economy unless you have this key, which is testing. I hope you had some appreciation for the breadth of knowledge, the depth of commitment, and the specificity of suggestions that our colleagues are making here today. They represent the concern of the House Democratic Caucus. More importantly, they represent the concerns of their constituents. Constituents who want, obviously, to open up, want children to go to school, want to be healthy, testing, testing, testing. So I thank them all for their leadership, for being with us this afternoon on this nearly around 100 days since the first death, 100,000 deaths later. We've got to put a stop to it. Thank you all very much, and with that, be pleased to take any questions. Yes, ma'am.
Madam Speaker, understanding everything you're saying about testing, parts of the country are starting to reopen. We are seeing a reopening plan. How soon do you think the country should reopen? How should we handle that? Is the President handling that correctly as well, especially regarding political conventions? Should we assume political conventions should go forward?
Well, let us say we all want the country to open up, but science tells us that there is a path, a healthy path, to open up in a healthy way. And that path is testing, tracing, treatment, and isolation if necessary. No, I don't think the President has handled it well. I don't even think he gives good example by wearing a mask, for heaven's sake. Not to protect him if he feels invulnerable, but to protect others. That's why we wear masks. The number of people who should be in church, a number of people who should be at any gathering, those are determinations that are made locally, and I respect that as we unfold this opening. I don't think there's anyone who would say at this point that tens of thousands of people should come together for a political convention, no matter how great an ego trip it is for somebody. It's dangerous for so many. So, but let's hope and let's pray that a vaccine is imminent, that a therapy or cure is nearby, but they aren't. Testing is. Let's go there. Let's go there first. Yes, sir.
Madam Speaker, can you describe where you are with the status of these ongoing negotiations, obviously given the Senate Republicans' sort of flat-out rejection of the HEROES Act? And have you had conversations with the administration, with Leader McConnell? What is the state of play?
A week and a half ago, we passed on the floor of the House the HEROES Act. HEROES Act, we gave nearly $1 trillion to states and localities to meet the needs of their constituents, of their people, to meet the needs of the American people. It went to them to meet the expenses they incurred fighting the coronavirus and also for the lost revenue. A week and a half ago, we passed a bill with a great strategic plan, thank you, Mr. Pallone, for testing. A week and a half ago, we passed a bill to put more money in the pockets of the American people. That was our offer to the Republicans, invite them to negotiate. When I read in some of my local metropolitan journals that it was partisan and nowhere to go, nobody said that when Mitch McConnell put forth his bill, CARES 1. Nobody said that when he put forth the next bill, right, Mr. Clyburn? The interim PPP. It was an offer. And we came, we negotiated, we turned those bills around, and we had bipartisanship. So I would like the same, shall we say, courtesy extended to the House Democrats for our putting forth our disciplined, focused, necessary legislation to kill the coronavirus, to open our economy, to send our kids to school, and to again, honor our heroes, our state and local workers, our healthcare workers, our first responders, firefighters, police, emergency services, transportation, sanitation, food service. Did I say that already? Teachers. The list goes on. Let's honor our heroes. Let's end this virus. Let's do that. And if they want to say no, I have news for them. The American people are on to this across the country, and my colleagues can attest. There's a drumbeat that says we need to do more. They need to do more. So my interest is with the message to the American people, send the Republicans in the Senate, that we cannot take a pause. We have to end the death, the dying. We have to open the economy. We have to do so in a way that gives more opportunity for access to care, to credit, to opportunity in our country. Because as Mr. Clyburn said, this is an opportunity. Every crisis is. Yes, ma'am.
Would you be willing to take the testing portion of the HEROES Act and put it forward as a standalone bill, the way you're doing with the PPP legislation later this week?
Our bill it has its oneness. It has its integrity. The only piece we took out was that PPP because it really every day made a difference. It was urgent. So too with testing. If I thought that they would pass it, I would. I think that maybe they don't share our value on that, or else they would have done it themselves. So we have to use other leverage in the bill as we go forward. Yes,
Madam Speaker, on the topic of reopening, the mayor of D.C. announced they're going to start rolling back the restrictions in the District of Columbia on Friday. Does that play into your decision at all about ending the state of emergency in Congress and bringing the full House back as opposed to keeping proxy voting and so forth going on longer?
Well, we are pretty much fully, we have a large number of members who are here. Again, it's transportation, it's individual situations with the virus and with someone who might be in their home, who might be susceptible. But we're here, and for those who can't be here, we have the proxy voting. And it is there for 45 days, starting today, right, Mr. Tom? It's starting today, 45 days. If we see a need at the end of the 45 days, then we can extend that. But our timing was predicated on the Sergeant at Arms and giving us the signal that we could put this forward.
So you wouldn't end it sooner than 45 days if conditions in DC continue to improve, or elsewhere in the
Well, let's hope and pray that they do, and then we can cross that bridge. We can cross that threshold when we come to it. Anybody? Yes, sir.
The House is voting this afternoon on this FISA
Excuse
bill.
me, just one second, if you hold on that. Any other questions and for my colleagues? Anything you'd like to say about any of the questions that were asked? Step up. Ms. Byron, anything?
I don't think so.
On whether we should take the testing piece out, whether what we think about the Republican. I said the same thing. That bill will never pass the House when they put forth their bills. That bill will never pass the House, right?
There's one thing I might mention, Madam Speaker. One of the things that we have in the HEROES Act is language, thanks to Frank Pallone, that asks the Federal Communications Commission to step up its allocations of billions of dollars that's already appropriated so that we can use this money now to do the broadband as necessary, Grace Ming talked about. Just South Carolina alone will reap $353 million. We asked them to do that by June 30th. And that is a piece of legislation that I'm going to be introducing along with Representative Upton of Michigan. The bill is being filed today because we think it's critical to spend out that money between now and June 30th because little children stand the threat of losing a second year of school if we don't have broadband available to them. And so the Speaker has worked with me, and we are going to propose that as a separate piece of legislation. Thank you.
Mr. Clyburn has been a champion working with, again, the Energy and Commerce Committee, Mr. Chairman Pallone, on this issue of broadband. It will be even more significantly put forth in our infrastructure bill, which we hope to bring up soon because it is so necessary. We thought it was necessary before, right? But then with district learning, with telemedicine, with so many things that are happening electronically, it's absolutely essential. We can have a whole press, well, we have had whole press conferences on that. So unless there are any other questions on testing, tracing, treatment, isolation? Yes, sir.
Thank you. The House is voting later today on this FISA
Yes.
bill, but you're no longer voting on a bipartisan amendment by Zoe Lofgren to limit the collection of internet search history. Why not? And if the underlying bill goes down, what's the recourse? What's your next move?
Well, we passed a bill a while back supported by the two chairs, Mr. Schiff of Intelligence and Mr. Nadler, the Committee of Jurisdiction of Judiciary. It passed in a very bipartisan way, actually a veto-proof amount, bipartisan, went over to the Senate. The Senate amended it in a very positive way. 80 senators voted for passage of the bill, 80 senators. Something like 30-some Republican senators voted for the bill. And it was more progressive than the House bill. The Leahy-Lee amendment took it to a better place, in my view. So that's the bill that's what is sent over to us. That's what we'll be voting on today. And if the Congress will work its will, if Congress doesn't want that, we have our original bill that we'll send back over.
But why not the Lofgren amendment? Why is that not being
That is up to them. We thought that we might take up, that was under consideration. Then the Wyden amendment gives different things, and we decided that where the votes were to go with the. Look, my long history in intelligence going back to the early 90s, either as member, ranking member, or ex officio all these years. We have to have a bill. We have to have a bill, and we have to have it signed. The administration, Attorney General Barr would like nothing better than not have a bill. Then you don't have all these protections that are built into our bills, and that's really what is essential about having a bill. Otherwise, you could just have an extension. But if you want to improve the protections, because it's always about security and civil liberties, so security and privacy, that's the balance you have to strike. And that bill in the Senate goes a long way, and it is strongly bipartisan. So that is the Rules Committee reported that bill out today. It's up to others in terms of consideration of different amendments. Mr. Clyburn's the vote counter, but we salute Congresswoman Lofgren. Congresswoman Lofgren is a real champion of civil liberties in the Congress of the United States, and she's just been remarkable, a very senior member of the Judiciary Committee, and she really opposed the first bill that we passed. The Leahy-Lee amendment was a vast improvement over it. Although our bill was good enough, this bill is much better. We hope that it would be the bill that could get the signature of the President of the United States. But we can, all kinds of things have been considered. This is the path we'll be on today. Thank you all very much. Oh, yes, sir. One more?
I just want to know your thoughts, Speaker Pelosi, on what's happening in Minneapolis with George Floyd's death and what should be done. Should the DOJ get involved?
You know, today we're talking about disparities and access to testing, disparities and access to health care, and the unfairness of it all. Mr. Clyburn began his remarks, as he usually does, talking about liberty and justice for all. This is such a tragedy. It's a crime. I feel so sad for the family, but also for just the community there. We had some conversations about this on our caucus call earlier today, and we have a couple of, some are hearings, some are forums and all the rest to continue that conversation and where we can go from here. There's a commission on the status of young African-American men. It's a bill in the Judiciary Committee that we've been talking about now, and all of a sudden, all the more necessary. Congresswoman Frederica Wilson has been talking about that for a while, including intensely yesterday and this morning. So it breaks your heart. It just breaks your heart. It's so sad, but there has to be liberty. There has to be justice there. Mr. Clyburn, may I yield to you on this?
Well, let me first of all thank you, Madam Speaker, and I thank our former colleague, Vince Ellison, Keith Ellison, I'm sorry. I saw him and listened to him last night, expressing tremendous amount of regret of this. It's kind of interesting. I spoke of Senator Rubio's comments in the Washington Post this morning that my memory serves the commission on young males, etc., that the speaker just spoke about. I think he mentioned that in his article, not that one I read this morning, and the necessity for us taking a look at restructuring. And we started in a bipartisan way. One of the things that we have worked with here, Democrats have worked with this administration on restructuring some things in our judicial system. In fact, Senator Klobuchar last night mentioned the fact that when she was the prosecutor, she followed what was the structure in place at that time, and she said, we got to change that. We got to restructure. I just think that we ought to really take a look at this pandemic, look at everything that's happening around us, and let's admit the fact that it's time for us to restructure some things in our society. We got to restructure things so that we can build out broadband, so that local, low-income communities, rural communities can receive the greatness of the society. We got to restructure things so that we can have online education for our children. We can have telehealth for rural and low-income communities. That's the only way to make the greatness of this country accessible and affordable for everybody. And justice is really at a threat in this country. And Rubio talks in his article about how if we do not do this, he sees real calamity in the not too distant future for our country. I've been seeing it for some time now, and that's why I've been silent this morning, because I go out there, I talk to people, I stop on the street corners. When I walk up down these hallways, I nod at the speaker and to Frank, but I spend time with the people who are scrubbing the floors and moving the furniture. I talk to them about their children. I talk to them about what their experiences, and I can tell you, we have got to do something to restructure things.
I know that you do that, but do they call you Mama? They call me Mama. Let's just close this by just mourning the loss of 100,000 people. Grace mentioned that such a large number were from New York State and how Elmhurst Hospital in her district was affected. Let's also just remember all those people in nursing homes. Like 40% of the deaths, I think, are in nursing homes. So very, very sad and heartbreaking for families. And of course, with me, it always comes down to the children. We want to be sure that when these people go to work, that they have the PPE and that they are tested so that they know when they come home, their children will be safe. I just close with the story Rashida Tlaib, Congresswoman Tlaib, told the day we were passing the CARES Act. She showed a picture of a beautiful little 5-year-old girl who just died of coronavirus. Her father was a firefighter, her mother a police officer. What's the question? How did she get this? And of course, they're big advocates now for testing about that. 5 years old, bringing home to the children. So we've got to stop this vicious thing because it's taking from our children, our parents, our grandparents, whatever, and everybody in between. And we have a responsibility to get the job done. That's why we say to the president, stop making excuses, take responsibility. That's what the president of the United States is supposed to do. In the meantime, thank you, Frank Pallone, for the wonderful legislation. We hope to soon get it passed into law, one way or another, and make a big difference for our country. Thank you all very much.
I'll send you the Dropbox link later.